Docs, and we have a special treat for you. Some of you might know from reading our emails or social media that right now in France is the International Congress. There's a worldwide congress going on. It is movement disorder specialists from all over the world, clinicians, researchers, all invaded Nice, France. And there are poster presentations, plenary sessions, networking, but I'm not there. So I wanted to, you can see if you guys will wave, you can see our featured guests there up in the corner. With that's not a green screen backdrop. That's really France. Isn't it beautiful? So I wanted to start, first of all, most of you know our CEO, Sarah Jones, and Sarah's joined today by Deborah Boland. She's a DO, a movement disorder specialist, and I love her background because she actually first was a practicing physical therapist and then, went on to become a movement disorder specialist. So her view of, Parkinson's and her patients is just so well-rounded. Let's see, she practices in Tampa, Florida, but right now is sitting in the lovely south of France in Nice. So welcome, Dr. Boland, and hi there, Sarah. And how's the congress going so far? Was my synopsis good? I mean, what has the event been like for you so far?
It's wonderful. It's so amazing and neat to sit in a room with, I don't even know how many people are here, Sarah, thousands and thousands of physicians, clinicians, basic science researchers, the greatest minds in the world, in the entire world, when it comes to movement disorder problems, are sitting together in a room collaborating. It's such a phenomenal, awe-inspiring experience. I love it.
And do you think that impacts, what ideas do you take home? How does that impact, your actual patient care?
Right. Well, you see differences around the world and you see similarities. And you see that this is really a global effort and all of these wonderful, amazing people working together and how we're all connected. And it's such a small world when it comes to movement disorders.
That's amazing. I think no matter what we are doing, it's so easy to get kind of,
right, in our little bubble.
Yeah. And we see what's in front of us, and how amazing to kind of take down those blinders and see that it's a global community.
Correct.
Well,
yes.
Any, and I don't know, Sarah, if you want to chime in too, any, highlights, what's been the most noteworthy or, moving thing so far? And maybe don't throw out a bunch of, scientific terms that we won't understand.
I think that last one was interesting that we talked about.
So I came over here to where I am from a lecture on the effect of placebo and placebo medications related to all of movement disorders, including Parkinson's disease, and how actually placebo and how the brain is truly affected at that cellular tissue level by placebo, and how there's positive responses when people take placebo medications. So it's an interesting concept.
Very cool.
Yeah.
And I think, maybe a lot of you watching have experienced the placebo effect. So interesting to hear the research that's being done.
Yeah.
As much as we wish we could just talk about how beautiful France is and hear what you had for breakfast every day, are the croissants really that good?
Yes, chocolate croissants and a cappuccino every morning.
Oh, so
delicious.
But we do want to dive into the content today. And so in addition to Dr. Boland there in France, also the PMD Alliance Vice President of Programs, who some of you know, Monika Sawdy. Can you say hi, Monika?
Hi, everybody.
Yeah, she is going to be doing this presentation in tandem because, as many of you know, when you go to your physician's office, there's a physician, there's a nurse, there's sometimes a physician's assistant, there's a whole, array of clinical staff, and we see and feel what it's like when they work together. But we wanted to see, you know, behind the scenes from a doctor's perspective, from a nurse's perspective, you know, what that relationship looks like and where and when it is most crucial. When we were preparing for this session, we talked about hospital stays and hospitalization and how that is, you know, just a very dangerous time for people with Parkinson's, but also really where, you know, you can't just rely on your, you know, movement disorder neurologist. You have to, you know, advocate for yourself and make sure that hospital staff, including nurses like Nurse Monika, you know, are all working smoothly together. So Dr. Boland, does that, you know, did you, I know you had some remarks prepared. Does that kind of fit into, you know, how you want to open this conversation?
Yes, absolutely. I think it's very important to collaborate with your entire care team and work together as a multidisciplinary team. So it's always tricky when patients go into the hospital. So whenever I honestly see a new patient for the very first time, one of the first things I ask them is, do you have a Parkinson's Foundation Aware and Care Kit? And I only use the Parkinson's Foundation because that's the one that I know best, and it's easily accessible to patients. So if they don't have one already and they don't have it all filled out, I go over, okay, this is how you get one. You need to make sure you have one because you never know when you might need to go into the hospital. We don't like unplanned hospitalizations, but that can happen sometimes. So you need to have one ready to go at all times and how important that is. And being aware yourself of what's within the kit. And then I talk about when you go to the hospital, making sure just doing something simple like putting that little bracelet on for yourself, because then that alerts the nursing staff or whoever may be touching you that, oh, what is this? Oh, this patient has Parkinson's. And so I think that's really just those little things make all of the difference. I really try to empower my patients to say, hey, listen, you order, you know, if they're cognitively intact, you order the kit, you fill it out. And then obviously when you go to the hospital, if it's a planned procedure or an unplanned procedure and you're under anesthesia or something like that, then your care partner needs to take care of those details for you when you're not able to. But as long as you're able to, I always encourage all of my patients to do as much as they can. And really knowing and understanding the kit and what's in the kit and what to give to nursing staff, and, you know, doing that when there's not an emergency or a problem is really important. And just being prepared. It's like I live in Florida, and, you know, being prepared for the hurricane and having your hurricane kit, and it's all ready to go in my big, huge tub in my garage, and I pull it out every year. And at the beginning of hurricane season, you know, go through it and make sure we have everything in there we need. It's the same principle with your Aware and Care Kit for expected or unexpected hospitalization.
Absolutely. And I know I've read some statistics and heard physicians say, you know, that a hospital stay can be very detrimental to someone with Parkinson's, can kind of set them back. Is there any, you know, can you put that in perspective, or not to scare everyone, but just to really convey the seriousness of what, you know, what you're up against?
So there's two issues in my mind with that. Issue one is if you're going under anesthesia, that can affect you cognitively. And it can also affect you from a motor perspective and a physical perspective, right? Getting that anesthesia out of your body, working with physical therapy, you know, so walking, those kinds of things can be more challenging. And then the second thing is there's a lot of medication problems because Parkinson's disease is one of the only diseases that the medications are dosed so frequently and so creatively, and there's not just one standard dosing regimen. So that leads me to another point that I wanted to make sure we bring up today. If it's a planned procedure, whoever is doing the procedure, whether that's a cardiologist and you're doing a heart procedure, whether that's a, you know, gastroenterologist, a GI doctor, and you're having a GI procedure, you want to request from your neurologist that your notes go, your last neurology note goes to that person doing the procedure or the surgery, because that way then they can plan ahead of time and send your medications over and your medication list to the hospital. That's the most accurate and up to date, because we all know Parkinson's medication dosing and quantity amount changes. And so just having that updated with the physician who's admitting you before you go is very important.
Very good. And I wanted to take this chance to introduce Monika Sawdy. So Monika, whenever I read her official bio about her nursing career, you know, she has run operating rooms. She's been the, you know, research coordinator. There is just so much that this woman has done, and it's interesting to compare. Sometimes in our, you know, in this space, doctors are, you know, the limelight is on doctors, and they are just so revered, and, you know, their value is not questioned. But some that means maybe there's less attention for the rest of the multidisciplinary team. Monika, could you kind of talk about the role of, you know, when you were in the clinical setting, you know, what the nurse's role is?
Well, the nurse's role is going to be even more important for the patient in the hospital setting, because they're the ones that are going to be there with you 24/7. Whether the physician usually comes in, they see you for maybe 5-10 minutes, every once in a while more, and then they will write orders, which the nurse in turn will have to act on and make sure that that care is provided to you. And that being said, it is very important to the whole care team, but especially the nurse. And as they change shifts, you know, you'll have different nurses at different hours of the day, that they all know about your immediate needs, as in your medication. From experience, what I have asked physicians to do, if for instance, with a patient that's on Parkinson medication, I have asked them to write special medication orders to stay in tune with the medications that are needed for that patient at the right times. Because in the hospital, there are certain times where medications are giving, you know, at 4 hours, 6 hours, 8 hours, 12 hours. But Parkinson medications are usually not on that regime. So that is why it's so important. And like Dr. Boland mentioned, having that patient aware care kit from the Parkinson Foundation, to have that information, because it actually has a little form in there that you could fill out for the nurses, so they know what your immediate needs are and they can act on that. And that needs to be provided to all the nurses within the hospital.
Very good. Well, Dr. Boland and Sarah, we're going to transition now to continue to grill Monika here, but we just wanted to say bye. And
bye. It was so great seeing everybody.
Great seeing you, and thank you.
Have a great rest of the conference there.
Thank you. We have video challenges tonight, so that'll be interesting.
Boy.
We'll see you guys. Bye.
Bye.
So, Monika, I know that Dr. Boland like almost led with the Aware and Care Kit and said that that's something that almost at the first visit. Could you maybe go in a little bit more into detail about, you know, what's in that and how you used it as a nurse?
Absolutely. Excuse me. And I apologize for the delay. Up where I'm at in the mountains in Arizona, there is sometimes an internet delay. So my apologies if you hear me, you know, staggered or acting like I'm not responding.
We haven't noticed yet, so you're good.
Okay. Well, then I notice it. Well, as long as I'm just the one noticing it. So the Aware and Care Kit, and I don't know if anybody has one. If you don't, I would recommend you order it. It is free from the Parkinson Foundation. You can go on their website, and Rebecca has put it in our chat feature, the number or the link for you to order that. It has a variety of items in there, which are very, very useful for the nurse or the team in the hospital. And as well as for you, it has a little hospital action plan. I don't know if you can see that. A little booklet that gives you a variety of information that's very important. it also has the little free bracelet that Dr. Boland referred to for you to wear. And again, in a hospital setting, that's very important. Now, this little bracelet is metal. So coming from a surgical background, we would take that off in surgery. But it's good for the surgical team to know that you have this little bracelet in that condition. There are forms for the nurse. There is a medication list that you can fill out. So, and like Dr. Boland mentioned, go ahead and fill that out and have it ready. Ensure your caregiver, you and or your adult children have a list of your current updated medication, especially if you have a planned stay at a facility, at a hospital, or having surgery. There is little cards in there, a medical alert card that you could put in your wallet, as well as little cards on what to do if you, for example, had deep brain stimulation. What are some things that you need to be aware of, as well as if you have a duopa pump. So those are some items that are important to the team to know. Any questions in regards to this little kit?
I know even just within the circle of people with Parkinson's that I know, both unexpected and planned hospital stays are pretty common. I mean, I can list 3 people I know who have been in the hospital in the last month. So
Right.
I like being prepared.
And having some type of plan, like Dr. Boland mentioned, having a preparedness plan when you have to have a planned procedure. Some of the treatment plan that you want to think about if you're having surgery, if you have, for example, have a deep brain stimulation implant, there is a potential MRI warning. Not all systems can go into an MRI unit. It's also good to have the surgical team know about positioning, depending on the type of procedure. If you have a DPS implant, you have those leads in your neck. So those are some things that is important for the team to know before you go into surgery. Suddenly stopping your Parkinson medications can be a problem. And again, it's very important that all of your care team knows what medications you have and when you take them at home, so they can try to have them provided to you at the same time. Another recommendation would be take your medications to the hospital with you. Often the pharmacy in the hospital does not have the same medication on their formulary than they would at your regular pharmacy. So, and just switching medications when you're on a set regime for your Parkinson's and have that under control, just a short stay in the hospital could set you back. So it's very important to have all that information with you.
Could I interrupt you there? So
sure.
The hospital formulary.
Yes.
And you all watching probably know this more than me, but I just want to make sure we're clear. So that's, the pharmacy in the hospital. And they don't have stocked every medicine ever.
Correct.
How many PD medications would they actually have? Like, is it just Cinemed, or, do they have some of the other major ones?
They could. Some of that is very specific to the hospital system. Like if you're in a neurological facility, a hospital that has a large neurological center, they're going to have more specific medications to treat neurological diseases. A regular community hospital or a small facility will probably not have a lot of those medications. They'll probably have carbidopa, levodopa, but are you able to take that dosage, that variation, because carbidopa, levodopa doesn't come in an IV form where they could give it to you through the vein. If you have issues swallowing, then you're not going to be able to get that medication. They have to look at alternative methods to get that medication to you. So,
got it. So you should make sure to bring your own medicine, huh? How does that work
Absolutely.
if it's an unplanned stay?
If it's an unplanned stay, again, your wear and care kit, if you don't have it with you at the time of your admission, have your caregiver, adult child, or friend ensure that that kit is always ready with some of your medication to bring it to you to the hospital, and let the nursing staff know that this is your medication. Often people have an extra set of medications in that aware care kit because it comes in a nice little bag where you could put medication in it.
Okay, and we're gonna play with some of our fancy tools here, and we have a poll we're gonna send to you. Just curious, so we know what the audience, whether you already have a detailed plan printed out, one in your glove box, one in your winter jacket, one in your purse, or whether maybe this is something that you're gonna be following up on. Okay. I don't know if you guys can see the statistics, but it looks like it's split right down the middle, Monika, about
I could see that, yeah.
right around 50-50 with the people who
right.
have a plan or an aware and care kit. Well, the aware and care kit's easy because we provided the link. What else would go into the plan?
Into the plan, especially, and this is, I'm looking at it, what I would want to know when you come to the hospital. I would probably ask you, have you discussed this with your neurologist or your primary care, whoever takes care of your Parkinson's disease or movement disorder? So, because not every nurse that's going to be caring for you is going to have time to read your whole background. It's a reality. They have multiple patients, so the more information you can share with the nurse caring for you, the better your care will be. It is very difficult to make sure every patient's need is met. And I, for one, have always appreciated the one-on-one communication with the patient as I look at their medications, as I look at their care needs.
And quick question.
Yes.
I know you can't speak for, everyone ever, but the typical nurse, if you're in the hospital because you had a hip replacement and you got to stay there a little bit, your typical nurse, how much have they been educated about Parkinson's, just whether it's nursing school and basic continuing education? How much does the typical nurse know about Parkinson's?
Well, it's been a long time since I went through school, and I've worked with Parkinson's patients for quite extensive time in my career, but the actual neurological training is very limited because you touch the whole spectrum of neurological diseases. So unless the nurse works on a neurological floor and takes extra classes to care for a patient with a neurological disease or a movement disorder, they're not going to have the background. And I've seen it over and over again during my career. And that doesn't make people a bad nurse. It's just where your specialty lies. But the communication is so important. And yes, in report, you hear, okay, we have a patient that has these conditions. This is the treatment plan for that patient today. But when you have 20 patients, I can tell you, even though there's a history that you can go back to it used to be paper charts, now it's all on the computer. Every nurse is not going to be able to go back and read your complete history, even though it's there if they need to. But we don't want to wait until there's a need for them to go back and read all of it. The report given is so minimal sometimes per se. And I sad to say, it's a reality. It's not bad care. It's just you're not going to know every little detail. Hence, while it's so important for the nurse-patient communication and the whole care team communication.
And did I hear you say at any time a nurse could be overseeing 20?
It can, depending on the hospital facility that you're at. Most likely you see those kind of patient loads in other care facilities. But if it's a regular surg unit, medical surgical unit, where often people will go after a procedure, yeah, you can have 10 or more patients as a nurse. You'll have, you know, a care technician helping out.
So absolutely.
Mm-hmm.
I think we'd all agree the medical system is not perfect. In an ideal world, those ratios maybe would be lower. You'd be in a specialty, you know, facility where people know, everyone knows Parkinson's, but you don't always know where you land. And what you can control is advocating for yourself, being prepared, having a plan, not being afraid to stand up to any of the, you know, the medical personnel taking care of you. Is that something, because I know many people are very deferential. I mean, you're in a hospital bed, you're naked, your butt's hanging out of that gown, like you're all tied up. It's a very vulnerable position. You know, it's hard to, you know, summon the confidence to advocate for yourself sometimes. You know, how do you recommend, or are nurses open to that? What if you get someone who's not open? You know, can you kind of talk about like the need to advocate for yourself, Monika?
Oh, absolutely. Nurses in general are open to discussion and hearing your needs. If you are in a situation where which probably could happen, someone that doesn't seem to listen, you always make sure, if you have an advocate with you, like care partner, I always say, you know, have someone with you in the hospital at all times. That's just my philosophy. But that's not always possible. But to ask to speak with the nurse in charge, if that doesn't work, to the department nurse in charge. There's always a department manager or a chief nursing officer, or all hospitals have a patient advocate. You can always ask to speak with them. That can advocate between you and your care team.
Very good.
So be vocal and speak up.
Yeah,
Absolutely.
you might have to take it up the
Yes.
screen.
Yes.
Well, we have had you all in auto mute, but now if you'd like to chime in with questions, we're gonna open it up. So if you would like to unmute yourself, go for it yourself if you know how, or you can type a question in the chat, or if you know, just raise your hand and then we can unmute you from our end. Anyone have any, you know, questions right off the bat, or maybe any, yeah, okay. I have one from Judy. If Rebecca, could you unmute Judy?
Okay.
Go ahead.
In terms of having an advocate with you, we've talked about that here in Sun City, and it's important that you have more than just your medical power of attorney. You should also have someone who knows you in terms of your Parkinson's. We had a letter, I was trying to find it while you were talking, but I see that I think Dave Hargraves is on, and he can comment on the letter because he had it. Anyway, to have somebody go with you to the hospital or come to the hospital and make sure that they understand what your medical or your medication needs are. Because I know for me, my medical power of attorney is my granddaughter. She doesn't know how I take my medication. She doesn't understand Parkinson's. And so you really need to have an advocate with you that can speak for you in case you're having trouble speaking for yourself. And we did have a letter, I don't know what happened to it, but I can't find it, that you can fill out and give to that person so they can show it, so they can be allowed to speak for you.
Mm-hmm.
So.
Yeah, thank you for that, Judy. That's very important and very true, because often the medical power of attorney is not living in the same town as as you may be. So to have someone that can speak for you, and you know, in that letter, I believe I've seen that letter.
Yeah.
So it is very important to have something in hand that you can share with the care team, because they are also bound by HIPAA rules. So there's always that in between there. But yes, thank you for that input, Judy. Appreciate that.
When you say they're bound by HIPAA, they cannot share your, you know, if the person who's with you in the hospital is asking a question to the medical provider about your Parkinson's, HIPAA might factor in there?
Usually what happens, if there's someone with you at the time when, let's say, the doctor or nurse comes in to speak with you about personal medical, usually what happens, they ask right there, is it okay if this person stays? So that's okay at that point. But to have a letter like what Judy referenced is just kind of preludes that, if, you know, in an emergency especially.
Or, oh yeah,
correct,
or an emergency,
correct.
or.
Yeah. Absolutely.
Very good. Well, we can track down a letter or a version and share that. And
Andrea,
yeah, go ahead.
this is Dave Hargreaves. I'm obviously not Donna. I'm using my wife's computer while mine is being cleaned up right now. I do
okay,
have a
Dave.
copy of that letter on my computer, and I can send it to you.
Okay.
I would also advocate for people to, the Department of Health and Human Services promulgated a regulation from their legal department in September of 2017. It's important for any patient, but particularly Parkinson's patients, to do what they have advocated and said. They should get their medical records, read them, and then use them, because you have a right as a Parkinson's patient to get the best possible care, and that can be based on your medical records. But it's important that people get the records and keep them. I have a special green folder at home with my medical records for this year alone, and it's probably about 3/4 of an inch thick. And I have medical records from prior years. But it's important that you not only get it, but read it, because there's so many mistakes or errors. And it, you know, in this day and modern age, it's not uncommon that transcription or something, an error could work its way into your file and not be caught. It's up to you to make sure that the records are, you know, current. But I will research and I'll look for a copy of that letter. I know it's in my file somewhere, and I will try to send it to you.
Thank
I'll
you.
look up your email address and get it to you.
Okay, perfect. That'd be great, Dave. And thank you for that input. I appreciate that, because it's so true that you do have a right for your medical records, and you do need to look at your medical records to make sure it's correct. And if it's not correct in your medical records, because people that enter that information are human. So we have a human factor that we all can make a transcription mistake, what have you. Information can get misconstrued during communication. So it's of utmost importance that you look at your records and have corrections made if you see something that's not correct. Because if not, it's going to continue moving forward through your records. And I have found mistakes in my medical records as well. I tend to get my copies of all my records and I read through them. And there are mistakes in there. There's, you know, sometimes you even have a medication in there and it's like, I've never taken that. Or you have a diagnosis in there that I don't have that diagnosis. And that's important that you have that correct information in your records. So thank you, Dave.
How do you actually get a copy?
You go to your hospital medical record department and request your records. They have to provide you your records. You have a right to those, even at the doctor's office. Some facilities ask you to pay so much per page. Most of them waive that, but I have heard that some medical record offices will ask you to pay per page for printed. So.
Okay, and I know, Monika, you have read medical records or two in your career.
Mm-hmm.
Dave, do you have a medical background? I mean, maybe as a layperson, could you comment, is it like reading, you know, Greek, or are you able to understand and follow along? I'll go ahead and unmute you, Dave, if you don't mind chiming in about that question. Oh, I can't unmute you. Can you unmute yourself?
Did you want me to answer?
Yeah, like when you are looking at your medical records, is it Greek? Is it understandable? Did you have to go to medical records 101, watch, a instructional video? How do you decipher that?
A lot of it is very understandable.
Okay.
However, there are a lot of words there that I find are Greek to me. I will automatically write them down and then go into Google and look them up and try to get the best understanding possible of what the doctor is trying to say. Mm-hmm. And they use terms which, quite frankly, are hard for us to understand at times, or they list a condition or even a medication. If I see a medication there, what does that do exactly? And I recently had to stop a medication that was causing low blood pressure, in addition to the fact that my Parkinsonisms, and I don't know if I have Parkinson's, was also causing low blood pressure. And when I woke up one day and it was 80/51, I said, whoa, I've got to look up every medication that I have, what I'm taking right now, and talk to my doctor.
Right. Perfect. Now that's a very aware patient. So it does us good if we're all cognizant of what medications we're taking and the potential side effects. All of our medications have some type of side effect. We know that, but they also interact. We hope that when our doctor prescribes a medication that they look at the rest of the medication and potential side effects. But that doesn't always happen. They just prescribe something and forget, or you have a prescription from a different doctor. Again, your whole care team needs to be aware of what medications you're on. Or I've had people where they go to 2 or 3 different pharmacies to get their medications because of cost or reimbursement. They get a cheaper price at a different pharmacy. Then there's that little piece lost on checking on interactions on medications. So it behooves us to really be cognizant of what we're, our healthcare, what we're taking.
And Jay Sims had a question. So you noticed something's wrong. You actually never had a 4th pregnancy. How do you get it corrected? Sorry if I wasn't clear. Monika, how do you get your medical records corrected if you notice an inaccuracy? Or maybe Dave, I saw you unmuted yourself. If you want to say, in your life, like, have you noticed errors and how have you gotten it? And was it fast? Was it painful?
After you've read the medical records and you see something which is an error, you've got to determine what doctor had put that in. And then you go back to that doctor's office and say, I'd like to question this as to why this says this and not something else. Or why did you put a medication in there? Because it's easy to, when transcribing records, to put in something it might be inaccurate. For example, I had one instance where I did have a medication that was listed as 2 81 milligram aspirins a day. I take 1. I went to my primary care provider and had that changed.
Okay, I'm sorry, Andrea, I probably didn't hear the initial question. Yes, like what Dave said, you go back to the office or physician where you found the incorrect entry, and you go either to the medical record area or in a doctor's office. You can check with the office manager to make a correction to a medical record, and then they can work with the physician as well to make sure that is accurate information in your records.
And sometimes it might be quite a saga. Sam said in 2016, a 5-day hospital stay generated a 550-page medical record.
Right. Yes.
my
When
God.
you're looking at all the care team that is involved, probably radiology, lab, the nursing team, the all the different teams, dietary, physical therapy, they will all have records in your medical records because they document. So yes, you can have quite of an extensive record.
Okay, and you mentioned care team. I have another question in the chat. So when we're talking about the medical team, how can we get them to talk to each other? So there's timely clinical notes and entered into the patient portal. But this person said their neurologist's company makes it difficult to get clinic notes sent to other members of the medical team. And they've cited HIPAA and requested that you fill out paperwork. And sounds like just the general runaround. Do you have any suggestions or strategies to help patients get information across their medical team?
I wish I could say that's an easy answer. It's not. There are actually guidelines on how soon medical records have to be in the system. So if you're in the hospital and your neurologist in the hospital has so many, I think it's 24 to 48 hours that they have to document in that system with your updated record if it's a non-emergency. My recommendation still is if you leave the hospital, try to get all your records, take it before you leave the hospital. Yeah, I wish there was an easy way to say, get them to communicate. I don't have an answer for that.
That's the $1 million question.
It is. I, haven't been in the hospital system. We have ran records from the office to the hospital to the office ourselves. If, somewhere it's caught in transcription or they can't print it out because the physician has transcribed it, but it's not signed yet, so it's not official. So there's so many little factors that can affect, the sending of the medical records. Unfortunately, yeah. That is going to be one of those tricky situations that we face.
I think we know so often medical teams are understaffed, overworked, whether it's the office staff or so it could be giving the runaround. It could be it creates extra work for people. It could just be, like you said, it's getting stuck in one of those steps. So, persistence, making a stink.
Yep.
Being that
be vocal.
Pain in the butt, where finally it's easier to just, give you some time than have to have you call and make a stink again. Yeah, I think if anyone has that figured out, please chime in. Is it easier? I know there were some questions, and I love that, people are asking for doctor recommendations, but is it easier? They're talking about Kaiser. Is it easier when your entire care team is in the same, system or network? I know that's not always possible because, again, insurance. Right. But maybe would you ever recommend people to choose their care team, thinking of how well they can work together and communicate, if that's even possible?
Yes, and a lot of the healthcare is going that way, to have big healthcare systems that offer all areas of healthcare needs, and they usually, with the having everything in computer systems now, they all supposedly, can't say that it happens 100% of the time, but they all talk so you can access, like, for example, I live up here in northern Arizona. We're connected through the hospital here in town to the major hospitals in Phoenix and throughout the area that this system has connection. We can pull records, x-rays, even have telemedicine throughout this whole system. So if there's a patient from this area having to go down into Phoenix and gets care there, our physicians here can still access those records. So that is a benefit, but it's not available everywhere. So there's always that, you know, potential lack of getting the information across. But, you know, even in a big system, as I registered, when I used to be the director of surgery, I had physicians that would put in a healthcare physical for the patient pre-surgery, which is a required documentation, but it wasn't signed. I could not let that patient go into surgery until that physician would sign his documents. So there are some of those rules that can delay care as well.
Very good. And we had another poll. Yeah, it looks like, thanks so much for chiming in, Dave, about the medical records. It looks like we might have prompted some people to take action. Even though Sam said his was 550 pages. But I think, Judy, you had a question. Did I see your hand raised? Do you want to go ahead?
No, I just had a comment on what Monika was saying. I did that when I moved over to Sun City to be closer to the movement disorder doctors here. I transferred all my medical care into that Banner family. And when I go into either my primary care or my neurologist, they go into the patient portal and bring up my records, and they have my records from all the other doctors also, and they can see what meds I'm taking and who prescribed what. And it really has, I'm not sure how foolproof it is, but it's given me a sense of security knowing that it's all in one place.
Right. It is definitely an improvement to care, but it's not 100% foolproof. So, and one of the things I just want to swing back on care in the hospital, it is not just standard yet on when a person with Parkinson comes into the hospital that everybody in the hospital that is going to be part of your care team knows how to care for you as a Parkinson patient. And I just want to again reiterate how important it is to have your spouse, yourself, or your advocate that's with you ensure that the staff knows about your condition, your limitations, whether you have swallowing issues, gait issues, you know, freezing issues. That is mostly not going to be on the top of the care team's thought process, especially if they're not specialized in caring for a Parkinson patient. So make sure that that is conveyed to the care team. And because I've looked at some studies which were quite scary to me, because patients with Parkinson are 50% more at risk for readmission to a hospital due to problems of their care in the hospital. So that's scary to me, and I want to do some more, look into that a little bit more, because sadly that's a reality of where we're at. And as we're learning more about how to care for our people with Parkinson and movement disorders, the healthcare system has to catch up in your care.
Absolutely. That's a scary statistic. I'm just reading through the chat messages here. So I don't know if I'm pronouncing this right. Talon. Is that how you say that name? Talon? She said yes. I think it's a she. Well, Talon is here attending for your dad. So thank you so much for, taking part in your father's, educating yourself to help your father, live with Parkinson's. And I'm glad maybe that Arthur recommended a movement disorder specialist, but I just wanted to touch on, she said she went with her dad to his appointment and did not like the neurologist. It's really important to have an open open, relationship where you feel comfortable and you feel like they listen. Could you just kind of talk about the doctor-patient relationship, and then, like in Talon's question, what to do if, the doctor's just not a good, maybe they're a great doctor, but not everyone, it's like a pair of jeans. You can't just take anyone off the rack. If it's not a good fit, what do you do, Monika?
Absolutely. It has to be a good fit. There has to be a communication channel that has to be open, and you have to feel comfortable and trusting of the person caring for you. So any good doctor will not tell you can't go to another doctor. I fully believe that, and it's your right to seek out a doctor that you can feel comfortable with, that your family member feels comfortable with, and establish a relationship with that doctor. So I fully support Talon. If that's not a good fit for you and your dad, find a physician that is.
Yes, advocate for your loved ones. If those of you
Absolutely.
who are care partners, be that, loud voice in the room. And I like what you said, that it's probably a sign of a bad doctor, or, a less than optimal physician if they, don't want you to see another doctor. So there's a huge warning sign right there.
Oh, absolutely. And it's your right to get a second or third opinion. If that's what you need to feel comfortable with the person caring for you, making important decisions, absolutely do that.
But real life, sometimes you wait 6 months on a waiting list to see a movement disorder specialist.
Right.
I mean, that's so frustrating. Do you just go on the next waiting list and wait another 6 months?
Unfortunately, that may be what you have to do if you're looking for a physician. Just make sure you have your medication regime, if you're on medication regime already, is covering you for that time period. Ensure you have the medications refilled or have a refill, and then I wouldn't just tell one doctor, I am not coming back to you until I have another doctor. You can let them know that you're looking at getting a second opinion. Absolutely.
Okay. And Judy, did you have a question? I see you're unmuted. Okay.
No.
You never know. So I never want to cut people off if they have a burning comment.
Well, I could make a burning comment.
Yeah.
I can always think of something. I think for people who maybe want to know more about this, there are, I know the APDA website and Parkinson's.org, they have articles on preparing for hospital stay. So there's some good information out there if you do a little research.
Very good. And we sent, Dave's going to find that letter that you referenced, and we can make sure that that resource is available so everyone's prepared. I think everyone maybe, it's never the most pleasant thing to talk about, preparing for the worst, but I know just from working with Monika, she is a big into preparing for the worst, hoping for the best. If, the power grid ever fails, I'm driving to her house in Payson because I'm sure she has, a generator and food for months and, a plan. But, yeah, Monika, any kind of closing comments on, anything that maybe you thought of that we didn't touch on to kind of
the main thing is, sorry, we're kind of lacking here. Yes, speak for yourself, advocate for yourself, and be prepared. Not necessarily having a generator. Generators are a good thing to have depending on where you live, but get your Parkinson Aware Kit and fill out the documentation. Keep updated medication lists with your caregiver, with you, and your adult children, because if it's an emergency type admission to a hospital, whether you are conscious or not, God forbid, we don't want anything to happen to anybody, but those things happen. So someone else has that information and can share that with the care team that's going to be taking care of you. So get those aware of care gifts. And if you have any questions, please feel free to reach out to us.
Very good. Well, thank you everyone for joining us today. If no one has any more questions, then we will put a wrap on it. Next month, we're going to be talking about urinary issues with Dr. Cynthia Reed. She's based in Tucson. So keep an eye on your email for more of that, but our Lunch with Docs are always the 4th Wednesday of the month, and we pick the time zone of the doctor. So this one was a little screwy because every movement disorder specialist almost is in Nice, France, going to this Congress. So next month will be business as usual. And since Dr. Reed is in Tucson, that's going to be at 12 p.m. Pacific. It's still not daylight savings time yet. And the 4th Wednesday of the month this year falls on Christmas and falls on the day before Thanksgiving. So we're actually going to pause for November and December and not have Lunch with Docs, because I'm sure you guys have to be marinating your turkeys and opening presents on those days, and then we'll resume in January. So again, October, urinary issues with Dr. Reed, and then we'll see you back again in January 2020. So thank you, everyone. Have a great afternoon or morning, or whatever time it is. And thanks so much, Monika.